Hi everybody, this video of mine is about ankylosing spondylitis. This is an inflammatory disease that over time can cause some of the small bones in your spine, which are known as vertebrae, to fuse. This fusing makes the spine less flexible and can result in a hunched forward posture. If ribs are affected, it can be difficult to breathe deeply. Ankylosing spondylitis affects men more often than women. Signs and symptoms typically begin in early adulthood. Inflammation also can occur in other parts of your body, most commonly your eyes. There is no cure for ankylosing spondylitis, but treatments can lessen your symptoms and possibly slow progression of the disease. Now I'll tell you the symptoms of ankylosing spondylitis. Early signs and symptoms of ankylosing spondylitis might include pain and stiffness in your lower back and hips, especially in the morning and after periods of inactivity. Neck pain and fatigue also are common. Over time, symptoms might worsen, improve, or stop at irregular intervals. The areas most commonly affected are the joint between the base of your spine and your pelvis, the vertebrae in your lower back, the places where your tendons and ligaments attach to bones, mainly in your spine, but sometimes along the back of your heel, the cartilage between your breastbone and ribs, your hip and shoulder joints. You should seek medical attention if you have low back or buttock pain that came on slowly, is worse in the morning, or awakens you from your sleep in the second half of the night, particularly if this pain improves with exercise and worsens with rest. See an eye specialist immediately if you develop a painful red eye, severe light sensitivity, or blurred vision. Now I'll tell you the causes. Ankylosing spondylitis has no known specific cause, although genetic factors seem to be involved. In particular, people who have a gene called HLA-B27 are at a greatly increased risk of developing ankylosing spondylitis. However, only some people with the gene develop the condition. Now I'll tell you the risk factors. Your sex. Men are more likely to develop ankylosing spondylitis than are women. Than your age. Onset generally occurs in late adolescence or early adulthood. Most people who have ankylosing spondylitis have the HLA-B27 gene, but many people who have this gene never develop ankylosing spondylitis. And now I'll tell you the complications. In severe ankylosing spondylitis, new bone forms as part of the body's attempt to heal. This new bone gradually bridges the gap between the vertebrae and eventually fuses sections of the vertebrae. Those parts of your spine become stiff and inflexible. Fusion can also stiffen your rib cage, restricting your lung capacity and function. Other complications might include eye inflammation, that is known as uveitis. One of the most common complications of ankylosing spondylitis is uveitis. This can cause rapid onset eye pain, sensitivity to light, and blurred vision. See your doctor right away if you develop these symptoms. Compression fractures. Some people's bones thin during the early stages of ankylosing spondylitis. Weakened vertebrae can crumble, increasing the severity of your stoop posture. Vertebral fractures can put pressure on and possibly injure the spinal canal and the nerves that pass through the spine. Heart problems. Ankylosing spondylitis can cause problems with your aorta, the largest artery in your body. The inflamed aorta can enlarge to the point that it distorts the shape of the aortic valve in the heart, which impairs its function. Now I'll tell you the diagnosis of ankylosing spondylitis. During the physical exam, your doctor might ask you to bend in different directions to test the range of motions in your spine. He or she might try to reproduce your pain by pressing on specific portions of your pelvis or by moving your legs into a particular position. Also, your doctor might ask you to take a deep breath to see if you have difficulty expanding your chest. Imaging test. X-ray allow your doctor to check for changes in your joints and bones. Although the visible signs of ankylosing spondylitis might not be evident early in the disease. Normally we recommend MRI, which I am going to tell you now. An MRI uses radio waves and a strong magnetic field to provide more detailed images of bones and soft tissues. MRI scans can reveal evidence of ankylosing spondylitis earlier in the disease process, but are much more expensive. Now, lab test. There are no specific lab tests to identify ankylosing spondylitis. Certain blood tests can check for markers of inflammation such as C-reactive protein and ESR, which we may recommend. But inflammation can be caused by many different health problems. So you need to understand that there are other conditions which can cause these test values to rise. Okay, your blood can be tested for the HLA-B27 gene, but most people who have that gene do not have ankylosing spondylitis, and you can have the disease without having the gene. Treatment. The goal of treatment is to relieve your pain and stiffness and prevent or delay complications and spinal deformity. Ankylosing spondylitis treatment is most successful before the disease causes irreversible damage to your joints. And I'll tell you the medications. Non-steroidal anti-inflammatory drugs such as naproxen and indomethacin, which comes with the name of indocin, are the medications doctors most commonly use to treat ankylosing spondylitis. They can relieve your inflammation, pain, and stiffness. However, these medications might cause gastrointestinal bleeding. If NSAIDs are not helpful, your doctor might suggest starting a biological medication such as a tumor necrosis factor blocker, TNF blocker, or an interleukin 17 inhibitor. TNF blockers target a cell protein that causes inflammation in the body. Interleukin 17 plays a role in the body's defense against infection and also has a role in inflammation. TNF blockers help reduce pain, stiffness, and tender or swollen joints. They are administered by injecting the medication under the skin or through an intravenous line. The 5 TNF blocker approved by FDA to treat ankylosing spondylitis are, and these are difficult names. Anyway, I'll tell you: adalimumab, that comes with the name of Humira, and then it's Cimzia and Brill, that is Etanercept, Symphony, and infliximab, that comes with the name of Remicade. This is a trade name. Okay. Interleukin 17 inhibitors approved by FDA to treat ankylosing spondylitis include secukinumab, that is coming with the name of Cosentyx, and exicizumab, that comes with the name of Taltz. TNF blockers and interleukin 17 inhibitors can reactivate untreated tuberculosis and make you more prone to infection. If you are unable to take TNF blockers or interleukin 17 inhibitors because of other health conditions, your doctor may recommend the Janus kinase inhibitor, tofacitinib, that comes with the name of Xeljanz. This drug has been approved for psoriatic arthritis and rheumatoid arthritis. Research is being done on its effectiveness for people with ankylosing spondylitis. Physical therapy has an important role in ankylosing spondylitis. It can provide a number of benefits, from pain relief to improved strength and flexibility. A physical therapist can design specific exercises for your needs. Range of motion and stretching exercises can help maintain flexibility in your joints and preserve good posture. Proper sleeping and walking position and abdominal and back exercises can help maintain your upright position. Surgery. Most people with ankylosing spondylitis do not need surgery. However, your doctor might recommend surgery if you have severe pain or joint damage, or if your hip joint is so damaged that it needs to be replaced. Now I'll tell you some lifestyle and home remedies. Besides seeing your doctor regularly and taking your medication as prescribed, here are some things you can do to help your condition. Stay active. Exercise can help ease pain, maintain flexibility, and improve your posture. Apply heat and cold. Heat applied to stiff joints and tightened muscles can ease pain and stiffness. Try heating pads and hot baths and showers. Ice on inflamed areas can help reduce swelling. Do not smoke. If you smoke, you should quit immediately. Smoking is generally bad for your health, but it creates additional problems for people with ankylosing spondylitis, including further hampering breathing. You should practice good posture. Practicing standing straight in front of a mirror can help you avoid some of the problems associated with ankylosing spondylitis. Well, if you are suffering from ankylosing spondylitis or any other health condition, please post your comments, and I'll try to make a video on your health condition, as this video was also requested by one of my subscribers. And also, if you till now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my video provides some sort of benefit to you, even if it is 5%, 10%, please like this video and share this video with your family and friends, and share these videos through social media such as Facebook and Twitter.